Bismillahirrahmanirrahim. In this lecture, we will discuss first the physiology of larynx, and then we will discuss the classification of the laryngeal diseases. First, physiology of the larynx. You know, larynx performs many functions. For example, protection of the lower airways, phonation and speech. Then respiration is another very important function of the larynx. Then fixation of the chest, and lastly, it helps in promoting venous return. Protection of the lower airways is a very important function of the larynx because due to sphincteric closure of the laryngeal opening during swallowing, it will prevent the entry of bolus into the airway. Rather, the bolus will go towards the food passage. This sphincteric closure is performed by aryepiglottic folds, epiglottis, arytenoids, and below these the false cords, and below the false cords the two vocal cords. All these perform function due to contraction of the adductor muscles. Similarly, when food comes into the contact of the oropharynx, there is swallowing reflex through 9 cranial nerve. So when this happens, there is temporarily there is cessation of the respiration, and in this way the food will go towards the food passage and it will not go towards the airway due to cessation of the respiration and due to the sphincteric closure of the laryngeal inlet. Similarly, whenever the food particles or any other foreign body comes in contact with the airway, there is a cuff reflex which occurs and the which leads to the expulsion of the food particles and foreign body from the airway. If it happens, this will prevent the entry of these two foreign body or food particle into the airways. Phonation and speech. There are different theories which explain phonation. For example, aerodynamic theory of phonation, myeloelastic theory of phonation, and neurochronexic theory of phonation. Out of these, aerodynamic theory of phonation is the most popular one. There are different phases of phonation. For example, pulmonary phase, laryngeal phase, and supraglottic or oral phase. In pulmonary phase, the patient, the human being first breathe in during inspiration. There is inflation of the lungs. The air pressure will build up and there will be expulsion of the air due to contraction of the thoracic and abdominal muscles. When this happens, the second, that is the laryngeal phase, starts. As I have said, there will be build-up pressure of air under the vocal cords in the subglottic area, and this air pressure will open the adducted vocal cords. Small puffs of air between the vocal cords, they will cause vibration of the membranous part of the vocal cords, and in this way a fundamental note or voice is produced. In supraglottic or oral phase, this sound which has been produced by the larynx is modified. Their resonation is added to this sound. In this way, the sound is modified and amplified with the help of oral cavity, pharynx, nasal cavity, and paranasal sinuses. And after this, the sound which is produced uh, is articulated in the form of words of sentence, that is, the speech is formed by the help of muscles of the tongue, lips, teeth, gums, and palate. As I have said, larynx also performs a passage for respiration. During aspiration, when the vocal cords they are in abducted form, in adduct, and in during inspiration, the vocal cords they are in abducted form. The air is inspired by the human being, and during expiration, the air is exhaled. And in this way, the it regulates the flow of air into the lungs. Fixation of the chest is another very important function of the larynx. When the larynx is closed, there is buildup of air pressure, chest wall is fixed due to, in this way, the main thoracic and abdominal muscles they act best in this situation to perform sternus work. This work, for example, in the form of digging, pulling, climbing, coughing, defecation, micturition, childbirth, and strain. And in this way, if the patient is having uh, laryngectomy, total laryngectomy done, for example, due to carcinoma of the larynx, in this laryngectomized patient, the patient will not be able to perform these acts like digging, pulling, climbing, coughing, defecation, and so on and so forth. So, fixation of the chest is a very important function to build up air pressure under the vocal cords to perform all these difficult tasks. Now, the classification of laryngeal diseases. The laryngeal diseases may be classified broadly into two main groups, congenital lesions and acquired lesions. In congenital lesions, we have laryngomalacia, congenital vocal cord paralysis, congenital subglottic stenosis, laryngeal web, subglottic hemangioma, laryngoesophageal cleft, laryngocele, and laryngeal cyst. In acquired lesions, these lesions can be further subclassified into traumatic lesions, inflammatory lesions, paralytic lesions, and neoplastic lesions. The traumatic lesions are again divided into acute laryngeal trauma, second, chronic laryngeal stenosis. The inflammatory lesions consists of acute inflammatory lesions and chronic inflammatory lesions. In acute, we have acute laryngitis, acute epiglottitis, acute laryngotracheobronchitis, and acute laryngeal diphtheria. In chronic inflammatory lesions, we have non-specific and specific inflammations. In chronic non-specific inflammations, we have chronic non-specific laryngitis in the form of chronic hyperemic laryngitis, chronic hypertrophic laryngitis, and atrophic laryngitis. In chronic specific laryngitis, we have tuberculous laryngitis, lupus of the larynx, and syphilis of the larynx. In paralytic lesions, we will discuss the abductor paralysis, adductor paralysis, and combined or complete paralysis. In tumors of the larynx, we will discuss benign tumors, malignant tumors, and tumor-like lesions. In benign tumors, we will discuss squamous papilloma, chondroma, hemangioma, lipoma, fibroma, and rhabdomyoma. In malignant tumors, we have squamous cell carcinoma, which is around about 90 to 95% of the cases. Then, apart from this squamous cell carcinoma, we have verrucous carcinoma, spindle cell carcinoma, adenocarcinoma, adenoid cystic carcinoma, sarcomas such as chondrosarcoma and rhabdomyosarcoma. There are certain tumor-like lesions of the larynx as well. For example, solid lesions and cystic lesions. In solid lesions, we have vocal nodules, vocal polyp, Rinke's edema, contact ulcer, intubation granuloma, and leukoplakia. In cystic lesions, we have ductal cyst, saccular cyst, and laryngocele. Thank you very much.